So it's been a year, or 3, since you last went for a jog, and because your doctor says that your cholesterol numbers are getting a little high, you decide to reignite your exercise routine. But just as you're halfway through, you feel a strain in your chest. You pass it off as your lungs finally working again. By the time you get another 20 yards, though, you can't ignore it any longer. That strain is now a pressure. But what is it? Can't be a heart attack, can it? Well, maybe it's not a true heart attack, but it could be the precursor to a heart attack, a condition called angina, which is a big red flag that the old ticker is acting more like an alarm clock.
The word angina is a specific word that implies that you have some sort of blockage that's in a coronary artery, one of the arteries that feed the heart. Angina is the sensation of a tightness or heaviness or pressure that's often in the chest area that most commonly occurs with physical exertion, sometimes with emotional stress, because when you're exerting yourself and the heart needs more blood, it's trying to pump more vigorously, but it can't get enough blood because there's a 90% blockage somewhere where the blood can't squeak through enough to supply the heart that's starving for more oxygen. So maybe at rest enough is squeaking through, but running up 2 flights of stairs, that extra demand, and the blood just can't get through that 89% blockage, and that presents a warning signal.
Angina is a serious condition, but its symptoms aren't so straightforward. A lot of things can cause discomfort in the chest, like a strained muscle or heartburn. The best course of action is to discuss any chest pain with your doctor, who is in a better position to separate innocent digestive problems from a serious case of angina based on your individual risk factors.
That risk can be related to age, so certainly a 20-year-old with chest pain would be 1 in 10 million that it would be a heart attack or threat of a heart attack, unless they had a 500 cholesterol or some other serious genetic problem. So when we say age and who's at risk, we look at the whole spectrum: age, high blood pressure, diabetes, smoking, family history, and other miscellaneous factors that all predict where somebody with no risk factors, no blood pressure, no smoking, no diabetes, no family history, for them a chest pain is far more likely to be a muscle pinch than it is a true cardiac symptom. So looking at the overall picture: who's the patient, what's their risks, what else is going on in their life and their examination, that's playing a role in our how serious we consider these symptoms that they're having.
The good news about angina is that it is a warning, and therefore an opportunity to fix any problems before they evolve into a heart attack.
If angina is due to a blockage in the heart muscle, in the coronary arteries, then that blockage can be treated with diet and exercise, including smoking. From your point of view, from the patient's point of view, from the physician point of view, we're treating blood pressure, treating diabetes, aggressively treating cholesterol, and every year the standards of aggressive treating cholesterol get stricter and stricter. The data is becoming more clear that we can stabilize and even melt blockages with very aggressive cholesterol lowering. So these statin cholesterol pills and other similar medications have been very helpful in dramatically and safely lowering cholesterol, which has caused a dramatic lowering in risk of heart disease in society.
If you're experiencing tightness in the chest while you're at rest, like watching TV, or if it occurs frequently and lasts for a long time, this may be what we call unstable angina, which is more serious and requires more intense treatment. Ask your doctor about it. Remember, your heart is one of the most vital organs. If there's pain around it, you definitely want to get it checked out. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.